UChicago Medicine is home to a thriving minimally invasive cardiac surgery program and has one of the most comprehensive range of robotic heart surgery options available. Our minimally invasive and robotic cardiac surgery program is internationally recognized for our surgeons' experience, the full spectrum of procedures we offer and our innovative techniques. Using robotic devices, sophisticated thin instruments, miniature cameras and hybrid techniques, we are able to repair the heart without having to make a long incision and cut through the breastbone. A wide range of robotic heart surgery options. Our surgical expertise spans everything from robotic coronary bypass surgery to patients needing intracardiac therapies for valvular problems, such as mitral valve regurgitation, all the way through patients needing surgery for arrhythmia problems. We have a very strong collaboration with our electrophysiology department, and have done some exciting things in terms of treating ventricular and atrial arrhythmias. We also treat some of the less common conditions, such as pericardial constriction, tumors of the heart and adult congenital problems. These are all treated surgically without requiring opening of the breastbone using the robotic approach. Minimally invasive cardiac procedures performed regularly by UChicago Medicine surgeons include implantation of ventricular assist devices and epicardial pacing to boost the pumping action of the heart in heart failure patients. Procedures to treat congenital heart conditions, such as atrial septal defect, patent ductus arteriosus and ventricular septal defect. Single and multiple vessel coronary artery bypass surgery, to improve blood flow to the heart and to reduce chest pain. Surgery to correct atrial fibrillation, a common type of arrhythmias. Valve repair and replacement to restore proper valve function. Our robotic heart surgeries are performed in the Center for Care and Discovery, Hyde Park, where the surgical suites in the hospital feature sophisticated diagnostics, leading-edge medical and robotic technologies and state-of-the-art imaging capabilities. The hybrid operating rooms unite the surgical suite and the cardiac catheterization lab, enabling surgeons and interventional cardiologists to perform multiple procedures in one setting and treat more than one type of heart problem at the same time. For example, a patient who needs mitral valve repair and bypass surgery can have both problems treated during the same operation without opening the chest. Why choose robotic and minimally invasive heart surgery? Minimally invasive and robotic heart surgery techniques offer several advantages compared to open chest procedures.